AvitaCare Atlanta is dedicated to providing HIV and AIDS treatment for everyone. And joining us now to discuss more is clinical lead Jewel Sawyer and clinical pharmacist Rhea Battle. Thank you both for being here.
Thanks for having us.
Okay, so Jewel, let's start with you on this first question. I know that you all are dedicated to combating stigma and also having open conversations around HIV and AIDS prevention. How do you do that work?
So we do that every day by having these conversations with patients discussing what are your risk factors for HIV? What are some of the social barriers and inequities that we face every day, especially as Black women, to making sure there's access to health care and improving health outcomes.
Yes. One of the ways that can be done is through PrEP. So can you speak to that for us?
Yes, PrEP stands for pre-exposure prophylaxis. It can be an injection or a tablet. It is for people who do not have HIV, who would like to take the medication in order to prevent getting HIV. Injectable PrEP is an intramuscular injection. You have to have the injections provided by a healthcare provider, so it does require you actually go into the doctor's office for a visit for them, whereas oral PrEP is a pill that you take, but you have to remember to take the pill every single day, but you can take that at home, obviously, so you don't have to go into your doctor's office. Additionally, the injection is every 2 months. One of the great things about PrEP is if you take it as prescribed by your healthcare provider, it is 99% effective at preventing the transmission of HIV during sexual intercourse, and roughly about 74% good at preventing transmission during IV drug use. Some of the things you have to keep in mind is it is only good for preventing HIV transmission. It is not good for preventing sexually transmitted infections like gonorrhea or chlamydia, and it does not help with preventing pregnancy either.
Okay, really important notes. Thank you for that. Now, Jewel, in the answer to my first question, you mentioned Black women. I know there is some new data out surrounding Black women in Metro Atlanta when it comes to HIV. What are we learning right now?
So yes, the recent CDC data tells us that about 19% of new HIV diagnoses every year are in women, but of that, about 50% are in Black women. That goes to show that we are definitely missing the mark, and we need to address it more. Also of that, we see that about 12% more of the diagnoses impact, again, Black women over their white counterparts. Also, speaking back to Rhea's point, there are only about 10% of cis women who are receiving PrEP who are actually candidates of it. So having open lines of communication, discussing who's a good fit for PrEP, and making sure everyone has access to it.
Really good information and also alarming. So thank you for sharing that. Rhea, as we close here, I know that you wanted to dispel a couple of myths before we go. What are some common misconceptions you're hearing?
There's a lot of myths out there. Just to, I guess, address a few. The first one I'll say is that you do not need to use condoms when you're on PrEP. Again, that is false. As I stated earlier, it does not help prevent sexually transmitted infections, and it does not affect prevention for pregnancy as well. Yeah. Another misconception is that PrEP is very expensive. Although it can be expensive, there are a lot of programs that help people get affordable coverage. Most private healthcare insurances do cover PrEP, as well as Medicare and Medicaid also cover PrEP. In addition to that, we have drug manufacturers that have copay assistance. Here at AvitaCare Atlanta, we have a whole pharmacy team that helps with our patients finding those copay cards and the patient advocacy programs. And so those are two of the major, I'll say, myths that we have today.
Perfect. Thank you both for being here and the important work that you're doing. It is really appreciated, and it helps obviously create a healthier community. So that's important. We want to all live healthy lives, which you can. And please, everyone, this is not just ending here, this conversation. You can find a lot more in terms of resources through our website to access AvitaCare, and our website is atlLiveshow.com.